Welcome to Ask Giri, the Physio Show, Season 6 and Episode 7. Today, we're going to talk about healing, science, and the human stories behind recovery. I am Girish Srinivasan, physiotherapist and CEO at Instep Physical Therapy, Edmonton. Today's episode is called Rewiring the Body, Healing from Chronic Pain and FND. Because what if I told you your brain and body can actually learn safety again? Both functional neurological disorder, shortly called as FND, and chronic pain are very real, life-altering conditions. And the fascinating thing is, they don't always show up on a scan. Maybe you have been told your tests are normal, or worse, that people telling you it's all in your mind or head, but your symptoms, the fatigue, the weakness, the tremor, or pain are real. At Instep Physical Therapy, we help people every day who live in that confusing space between the brain and the body and guide them back to connection. For centuries, medicine tried to separate the mind from the body. If doctors couldn't see the cause, patients were labeled hysterical. Thankfully, neuroscience has moved on. Now we both know FND and chronic pain are functional changes, not structural damage. Your nervous system is not broken, it's just misfiring. Think of it like a software glitch, not a hardware failure. That's good news because software can be rewritten. Modern MRI and EEG studies show that in both chronic pain and FND, the brain's prediction systems go off course. Regions like the amygdala, insula, and anterior cingulate cortex in your brain, which kind of regulates emotion, pain, and movement, start sending mixed messages. The result? Real symptoms with normal scans. That's why both conditions respond best to a biopsychosocial approach, treating the biology, psychology, and social context together. That's when you get great results. Let me share a story. Sarah came to us after a stressful life event. Her MRI was clear, but her leg wouldn't move. During our first session, I asked her to kick a ball. Nothing happened. Then I tossed it playfully, and she caught it. Her leg moved. That tiny movement changed everything. Using graded motor imagery, distraction training, and functional retraining, she began to reconnect, along with cognitive functional therapy too. Weeks later, she was walking again, not because her muscles grew stronger, but because her brain remembered how to feel safe. So that's the hope. If your brain can learn pain and dysfunction, it can unlearn them too. That's what rewiring the body is all about. At Instep Physical Therapy, we do integrated team approach. We take a trauma-informed whole person approach. Our multidisciplinary team includes physiotherapist, massage therapist, lymphatic therapist, kinesiologist, psychologist, speech language pathologist, and everyone. We trained in cognitive functional therapy, graded motor imagery, and FND specific physiotherapy and rehab, all backed by modern research. Together, we help calm the nervous system, rebuild movement, and restore trust. Because healing is not about pushing harder, it's about reconnecting safely. If this sounds like you, if your pain or movement issues don't make sense, know this. We believe you. Your body is not failing you, it's protecting you. With the right guidance from our team, the body can learn safety again. So, don't wait. Call Instep Physical Therapy today and ask for one of our trauma-informed physiotherapists trained in FND, chronic pain, and neuroplastic rehabilitation. Let's start rewiring your body together. Thank you again for tuning in to Ask Giri the Physio Show episode. If this episode helped you kind of understand your body a little better, share it with someone who needs hope today. Healing starts when you feel safe. Stay curious, stay kind to your body, and keep moving.